My name is Abha Maheshwari. I'm one of the consultants at NHS Grampian, and I'm Chief Investigator for the e-freeze trial, with which I'm working on with National Perinatal Epidemiology Unit in Oxford. E-freeze is a large randomized control trial happening across the UK. It compares two types of IVF. One is fresh embryo transfer, in which you create the embryos and transfer them within the same week, that is fresh embryo transfer. The other kind is the frozen embryo transfer, in which you create the embryos, freeze them, and thaw them and transfer within 3 months in the womb. And we are going to compare that out of these two methods, which one gives us more chances of having healthy babies. Basically, IVF has been there in the world from last 37 years, and we've been getting very good at IVF. Over 6 million babies have been born as a result of IVF. There are a few problems with it. One is, because we are stimulating the ovaries to create number of eggs, we are exposing women to lots of external hormones. And these hormones produce a risk of what is called as ovarian hyperstimulation syndrome. The second issue with the current IVF is that despite rapidly improving technology, we are not getting any better at the success rates. Third problem is that the babies born as a result of IVF, the pregnancies are more risky when you compare them with those born as a result of spontaneous conception. That is why we need to think how we can make IVF safer. So one way of making IVF safer is dissociate the connection between exposing the woman to hormones and then replacing the embryo into the womb. And one way to do it is by doing frozen embryo transfer. The evidence about frozen embryo transfer is growing, and the limited data so far suggest that the pregnancy complications, if a pregnancy is the result of frozen embryo transfer, are less when you compare them with the fresh embryo transfer pregnancies. In terms of pregnancy rates, there are small randomized controlled trials which suggest that pregnancy rates are equal whether you do fresh embryo transfer or frozen embryo transfers. And we know that the risk of ovarian hyperstimulation is minimized if we were to freeze the embryos and transfer them later. However, currently we don't know whether it is enough evidence to change the practice. There are 12 clinics across the UK which are participating in this trial, and we are going to recruit 1,086 couples. The couple undergoing first cycle of IVF can take part in it. Woman has to be between 18 to 42 years of age. The couple have to be resident in UK, and they have to be able to provide written informed consent. There are some exclusion criteria. If you're using donor eggs or donor sperm, if freezing of embryo is already planned because of medical reasons, if you're undergoing any genetic testing, such as pre-implantation genetic screening or diagnosis, those couples will be excluded from this trial as well. If you have got 3 good quality embryos, then you will be allocated to either fresh embryo transfer or frozen embryo transfer. The primary objective of e-freeze is to find out which method of embryo transfer, fresh or frozen, will give you a higher chance of having a healthy baby, because the aim of IVF treatment is to have a healthy mother and a healthy baby. And the way we define healthy baby is by one baby which is born after 37 completed weeks of pregnancy and has got weight which is appropriate for the time when it is born. It is a broad pragmatic trial, so once the results are available, it is going to be directly transferable to the clinical practice.